At the Orthopedic Institute of Dayton, we're a multi-specialty group of fellowship-trained surgeons. A fellowship-trained surgeon is one that focuses primarily in one subspecialty of orthopedic surgery. For example, spine surgery. After we complete a rigorous training in orthopedics, we then go on and do only spine surgery. So a fellowship-trained surgeon has dedicated their career now to only a specialty of orthopedics.
After going through 3.5 years approximately of severe pain, I went through all the other options with Dr. Grisoni, and when it came time for surgery, my life changed dramatically due to that surgery. It was like someone flipped a switch. Once I went through the healing process post-surgery, my physical capabilities are right back to where they were prior. Being in the medical field, I would personally not feel comfortable having a non-fellowship trained physician operate on my spine. They have a high level of different type of training than someone who just went and did some general training.
My patient care philosophy is somewhat unique. I treat everyone like they're a family member, and I spend a lot of time with patients trying to make them understand what type of problem they have, why they have a problem, and the different options available for them. So we spend a lot of time looking at X-rays and MRIs, and then utilizing bone models and dry erase boards to make it very simple for them to understand why they're here in the first place. And then we talk about all the different treatment options for them, whether it's operative or non-operative.
Dr. Grisoni had pictures of the spine. He showed me what my problem was. He had my MRI on the board and pointed out each disc, what the problem was with each one, and where the surgery what he would do during the surgery. He had a whiteboard. He drew pictures of my neck and, explained in detail what he would do, what it would be like when I got into the hospital, what I would find when I woke up out of the anesthesia. He was very precise. I had no surprises at all. You hear horror stories from people that have back surgery and say, oh, they're sorry they did it. I have no regrets at all.
So many patients ask me about the potential risks of spine surgery, the most catastrophic being loss of spinal cord function or nerve paralysis. We spend a great deal of time understanding, number one, is surgery necessary? Number two, what type of outcome is expected? And again, three, the potential risks that are involved. So patients leave my office very educated, not only in terms of what their spinal pathology is, but the potential risks and the benefits.
I think Dr. Grisoni goes out of his way to explain everything that he's going to do and lays out a lot of options for you. Surgery would be his last option for you, quite frankly.
Once someone gets a label of chronic back pain, they sort of kind of get put in a corner, and it takes someone like at our institute here to spend some time with them and identify where the pain's coming from, because many times they've seen multiple specialists, but no one has taken the time to find out where the pain generator is from. And once you identify that, then you can open up a whole window of treatments for them. I've had a few patients that we've gotten to know that we spent a lot of time, kind of started from scratch, and identified where the pain's coming from, and offered them a different treatment that they never had before, and they've turned their life around.
Oh, Dr. Grisoni is a very caring physician. I was pleasantly surprised how much concern he showed for me and the pain that I was in at the time.
I think patients, when they come and see me, they can expect to find someone that's very caring, and they'll spend a lot of time with them trying to find out what's wrong and what options are available.
I have recommended multiple people to Dr. Grisoni due to my experience with him.